the Toronto Star, I'm Sabah Itazaz, and this matters. When we look back at this and try to remember where it all began, where we first went wrong, we might find ourselves looking at Peel. With not enough support, not enough testing, and now not enough vaccines, this region has been neglected at every wave of COVID-19. And Black and brown bodies paid the price. Peel is both a gateway to Ontario and its manufacturing hub, and this region has the highest COVID case rate in the country. This is where thousands of essential workers kept things running for us as we went into lockdown in the comfort and privilege of our homes. This is where the local officials eventually had to take matters into their own hands to save their people. And this is where 13-year-old Emily Victoria Viegas became one of the youngest Canadians to die from COVID. The story of Peel is actually the story of this pandemic in Canada. All the things we could have done better, but didn't. But there's another story that runs deeper under the surface that we don't like to talk about much, of systemic discrimination, of disparity and difference. Fatima Syed, a freelance journalist, has traced that story, and she's on This Matters now to talk about Peel and how we got here. Hi, Fatima. Thank you so much for being on the podcast.
Thanks for having me.
I want to start by asking you how you are doing, Fatima. You have a unique connection and perspective on what you've reported unfolding in Peel. I want to know how that experience was for you.
It's been very heartbreaking and very overwhelming at the same time. You know, I've lived in Peel region for 10 years. Basically, as long as I've been in Canada, this is home base. This is where I've grown up, where I've learned so many things, where I've come into my own in so many different ways, just personally. So professionally, for me to be reporting on the community that I know so well, that has been there for me for so long, has been an interesting experience, but it is all the more important for it.
Tell me a little bit about Peel region. What areas fall under this? What's the demographic like? Who are the people who live there? And how does that play into some of the reasons why Peel has been one of the hardest COVID hit regions in the country?
Peel region is made up of 3 different municipalities. So we've got Brampton, Mississauga, and the town of Canadaland. The region is so expansive. It includes everything from like your urban center to literally rural farmland. You've got warehouses here, factories here, you've got industry here, you've got multi-generational housing here, because this is also home to the most diverse and multicultural population in the province. You've got the largest number of immigrants, the largest number of international students. It is just beautiful, complicated, diverse community that has the best food, in my opinion, and the best culture. And it's massive. It's, you know, you could drive from Lakeshore in Mississauga to the town of Canadaland, and it would be like a 40-minute drive. And you would go through like farmland, highways, urban centers, residentials. It's a beautiful drive. And that's the region that we're talking about. And that's the region that's been the hardest hit during the pandemic.
Right. And while many of us have been working from home, we've had that privilege to be able to be in lockdown. This region has basically kept the country running, hasn't it, as you speak to in your article?
You know, there are so many cities across Canada that literally froze in time when the stay-at-home orders were given and the lockdown started. Peel never stopped. Peel never stood still because Peel residents were still going to work. Partly because they had to, right? We're talking about low-income immigrant communities that need that paycheck to support their families, that are multi-generational. They have ailing grandparents, they have young children, they're supporting relatives back home. They need that paycheck for so many different reasons. But then when they're going to work, they're also helping other people in the province, like you and me and all of the listeners of this podcast, put food on their table. There would be nothing in Costco if Peel didn't go to warehouses. There would be no Amazon packages arriving at your doorstep if workers in Peel didn't go to work. So, you know, never once has that been acknowledged properly during this pandemic, that this region was incapable and unable to stay at home at any point this past year. And nothing was done to ensure that while they were leaving their homes, they were kept safe. And that is why we're seeing caseloads still increase over a year, and why Peel Region is still the hardest hit area in the entire country.
And as you mentioned, this region is the hub of these frontline essential workers who've kept things going for us, but have paid the disproportionate price of this pandemic. And there are so few of these workers whose names we know. But in your article, you do introduce us to some of them. Tell me about Gurdeep Dhillon. You mentioned how he and his colleagues might have been among the first infected, potentially.
Gurdeep Dhillon is an airport taxi driver who's been in that job for 35 years. He's literally done it for as long as he's been in Canada. He takes great pride in his work. If you talk to him about, his job, he says that it was an honor and a privilege to welcome people to Canada, to take them to their new homes or to just take them to wherever they were visiting in the province. And when the pandemic started, he didn't know what to do. He recalls picking up this couple from Hong Kong who were all masked up. And they sat in the back seat of his taxi, which didn't have a shield yet, which didn't have any sanitization procedures yet. And he looked at them and he asked them, he's like, "Oh, you're wearing a mask. Should I be wearing a mask?" And they didn't speak English very well. So they kind of just told him, "If you want." And he didn't know what to do, and he didn't have the equipment to do it. And in the weeks that followed, Gurdeep lost 10 of his colleagues, some of whom he'd been working with for 35 years, who were his closest friends, who were basically family to him. And those 10 deaths remain the highest known death count in any workplace in Ontario. And we don't know all of their names. We don't know any of their names for that matter. And we don't know how they caught COVID. We don't know their struggles. We don't know what state their families are in right now. And that's the most heartbreaking part of the story, where workers are struggling, suffering, and dying in the margins. They are completely invisible to us because they're too scared to even talk to someone, in fears of losing their jobs or contracting the disease and what that would mean, and so forth. So there's a huge debt we pay to people like Gurdeep and his colleagues that we haven't even begun to start paying. And we're seeing them in the case numbers, and we haven't put names to those numbers yet. And that is the most heartbreaking thing to me.
In your piece, you quote the mayor of Mississauga, Bonnie Cromie, saying, "You can't stop the spread of the virus if you don't stop it in Peel." Can you explain that? Did the interconnectedness of this region to everywhere else, essentially, and then the way the government responded here play a part in how COVID spread and the escalation and the tragedy we are seeing now?
Peel is basically the gateway to the entire province, right? Not only because the airport is here, the airport is in Mississauga, even though it's called the Toronto Pearson Airport. It also is just so seamlessly connected to every other region surrounding it. You've got Oakville and Halton Hills to the north, you've got Toronto to the south, you've got Milton. It's literally surrounded to other regions. And people move about really easily. Peel is a driving city. People get in their cars and go to Oakville, they go to Milton, they go to York Region. It's all very easy to do. And that was part of it. The three mayors of Peel Region knew that was the case. And from the very beginning, tried to ensure that all the Greater Toronto Hamilton area mayors were on board in creating a consistent plan, because they knew people would be going across the region, whether it was for work or just because of the ways they live. Someone who lives in Peel doesn't necessarily work in Peel. They work in Toronto, they work in Hamilton, they work in York Region. They literally go all over for life and for work. And so they tried to create this consistent policy. But of course, it's difficult when you have a provincial government saying, well, Milton to the north of Peel doesn't have that many cases, so they can open up. Peel, which still has lots of cases, has to remain closed. So it is human nature for people in Peel being like, oh, well, why don't we just go to Milton and, I don't know, go to a shop there or go to a restaurant there? I don't blame people for doing that. The option was available to them. It's not that far. It's a 10-minute drive. That sort of is a factor in why COVID spread across the region, right? So you had a large working force that couldn't stay at home. Then you had seamless travel across the region and in all the areas surrounding it. And then you had multi-generational households. So the workers who were leaving the house or the people who were traveling across the region are coming home to large families, which I've explained wasn't just a cultural necessity, but an economic necessity. Housing prices in this region are really, really expensive. So people live together to save on childcare and to save and to pool income to pay for shelter. And when they bring COVID home to those multi-generational households, that then turns into community spread. And Peel Public Health has been saying that from the beginning. They knew this was going to be the way that COVID spread across the region. And that's exactly what happened. And never once did our pandemic policies take that into account.
And like you're talking about it, we saw local officials like Dr. Lawrence Lowe feeling the need to step in and take matters into their own hands to try to protect Peel. And I want to mention a quote by Dr. Nahid Dosani that you included in your piece. When we look back, we'll look at the people of Peel and how we could have better protected them. Is that the prevalent feeling that Ontario has failed Peel?
I think there's great anger and great frustration among Peel residents, whether you talk to doctors here, teachers here, frontline workers, essential workers, warehouse workers, parents, kids, even young people of Peel. The prevalent feeling is that they have been completely neglected and abandoned by the provincial government. They didn't get enough tests. They didn't get enough vaccines. They didn't get enough communication. They didn't get enough outreach. It's just, we didn't get enough. We put ourselves at risk to serve the province and make sure that its engines were still running in the worst of times. But the province didn't do the same to help us feel safe and protected. You know, if you talk to the workers, you'll hear them say that, I had to go to work. I needed that money, but I didn't have to feel unsafe. I didn't have to get sick. And that's the entire problem, that the elected officials did not do enough to protect the residents of Peel from the spread of the virus. And they knew exactly what to do, and they didn't do it.
We'll be right back. And this has not been an equal opportunity virus, as we've seen. We have not seen an equal response or a vaccine rollout. You could say Kingston might have had a very different pandemic than Peel, for instance. How did structural and institutional inequity and disparity play a role in how COVID hit the communities here?
Brampton has one hospital and it has a population of over 700,000 people. Mississauga has two hospitals, both of them on opposite ends of the city. You have to drive there or take the bus there. There's three hospitals catering to almost 1.5 million people in this region. Just think of that for a second. Those of us who are familiar with Toronto, there are 5 hospitals on one street with 2 transit stations that you can easily get to. There are 3 hospitals in the largest region of the province, and you have to drive there or take a bus there. And they were already stretched thin before the pandemic even started. A few months before the pandemic was even declared, the mayor of Brampton, Patrick Brown, and the city council declared a state of emergency in healthcare because we were seeing people die in beds in hospital corridors because there just wasn't enough room. So when the pandemic starts and you know that it's going to be a health crisis and you know you're going to see an influx of patients and you already don't have enough beds, you already don't have enough staff, you already don't have enough space, it's just a disaster waiting to happen. Anyone looking at these numbers, anyone looking at the state of resources that Peel had would have told you at the beginning of the pandemic that we are not prepared. And they weren't. When the pandemic started, hospitals had to, send patients to different regions, as far as Kingston, Ontario, to make room for COVID patients. And then tie that to the fact that there is a multicultural community here that had linguistic barriers. You needed translation devices all of a sudden because you couldn't have translators. You had to shut out caregivers who could properly speak to patients. It was one huge problem after another that was already deeply rooted in Peel's society and had not been addressed for years, if not decades. And that's the entire problem, right? Peel was just perfectly set up for the worst things of the pandemic to happen. And at the beginning of the pandemic, as a society, we all promised each other that we wouldn't do things unfairly. We would be equitable. We would take care of the most vulnerable of populations. We would be mindful to all communities, but they weren't. And we saw the brunt of that take place in Peel.
And the provincial government says it's since amped up its vaccine outreach and eligibility efforts. What's that looking like on ground? Have you managed to book vaccinations for yourself, your family?
There are a few pop-up clinics opening for 18 plus here in Peel region in places of worship. And I spent several hours on the phone yesterday trying to get me and my sister booked. And, the line was busy or it hung up or we didn't get it. So we filled out a form and we haven't gotten confirmation that they've received the form or that we've gotten a booking. So we're just hoping for the best. And of course, we're privileged. We're able to stay at home and we don't have to put ourselves at risk. So if we don't get it, it's not the end of the world. But the fact of the matter is we had the time and the privilege and the resources and the knowledge, quite frankly, to do this. I think about all the workers who didn't have the time to book an appointment, who need it way more. Peel still doesn't have enough vaccines, right? Like we've only have 7.5% of the provincial allocation, and yet we have 20% of the cases. We have a handful of mass vaccination clinics that are up and running and that are doing well, I hear, in terms of, a steady pace of vaccinations being administered every single day. But the fact is, the largest issue right now is how do you get to the populations that aren't going to go to the mass vaccination clinics? Because that's what's happening. Not everyone's going to go to the mass vaccination clinic. Not everyone knows how to even book an appointment at a mass vaccination clinic. So how do you, as an elected official in a government and a regional health unit, go to the communities that aren't even going to think about this? So we're seeing more pop-up clinics emerge right now. But the problem is the booking system is still chaotic. You still have to call in. You still have to use a computer and fill out a form. There's no here's a vaccine clinic, come and line up. And then who has the time to line up because you're a worker and you have to go to work every day. So there's a lot that needs to be worked out and worked through. And meanwhile, cases keep increasing. I feel for Peel Public Health because they have an impossible task. They're serving a very complicated, very vulnerable, very marginalized society. And they're doing it with stretched resources. So I feel for them. I really do. But at the same time, it angers me that we knew all of this and we didn't plan. As a provincial government, as a province, we didn't plan for Peel region. We didn't take into account all the challenges and specific community needs here. We saw that when the tests were rolled out, there weren't enough tests. We saw that when vaccines were rolled out, there are not enough vaccines. And one can only hope that that's going to change soon, but who knows?
We saw a lot of too little, too late is what a lot of people are saying. Fatima, a few days after your article came out, we lost 13-year-old Emily Victoria Vegas, and she was from Peel. And the day after that, the provincial government actually voted down paid sick leave, then attempted to float their own version. What was going through your mind, and what's going through your mind now when you see this sort of politicization around something like this at this time?
I didn't know whether to be angry or sad, quite frankly. It was the worst thing that could possibly happen in Peel region. I didn't know. I still don't know. I still don't know whether to be angry or sad because I am incredibly sad when I see the state of affairs of Peel region, when I see just how abandoned and neglected it has been from a structural, institutional, and political context. I'm incredibly sad to see that it was also preventable. I think I'm just completely sad and angry and discouraged that this was all so completely avoidable. And that in the 7 days, it's now been over a week since she died, nothing has changed. Paid sick leave is now a political issue. No elected official has, done anything concrete for Peel. Of the elected officials that voted down paid sick leave the day after we learned of Emily's death, 7 of them were MPPs from Peel region. And that hurt my heart. I know I'm a journalist and I'm meant to be objective and I'm meant to, report the news and provide context. But as a resident of Peel, as a human being, as a young person, I don't understand how we lost a 13-year-old girl that we know of, and who knows however many others, the 10 airport limo taxi drivers and whoever else that we've lost that we don't even know of. And 7 MPPs that represent the hardest hit region in the province, in the country, voted against the one thing that could have helped. It doesn't make sense to me. And I hope someday they will explain their reasons and they will be held accountable for that, because it really doesn't make sense to me.
Fatima, we've also seen that this pandemic has been tinged with racism and anti-Asian hate, even as Black and Brown people bore the brunt of COVID and bad policies. And you've dealt with some of that too. And I've also seen some backlash that you talked about since you wrote this piece. Do you feel comfortable sharing some of that?
It was encouraging that my story in The Local got such an immense response. I've always been of the thought that no one cares about Peel Region. And it's always been a huge rant of mine, because there's so much that happens here and it's responsible for so much of the province's success economically and institutionally and so forth. So I was encouraged that people were woken up to Peel Region by the story. But at the same time, I got so many comments that still blamed the residents of Peel. And I should have expected it, because we've seen that throughout the pandemic. During Diwali, everyone was like, well, of course, they're hanging out, so that's why cases are increasing. Or every time there was Eid, then they were like, oh yeah, well, these brown people, they're just celebrating. They don't care about COVID. When at the heart, the issue was they literally had to go to work and couldn't stop going to work. And I got some of those comments. A lot of people were like, it's your people's fault, because I am South Asian, I am brown, and I'm from Peel. And a lot of people, send me messages along the line of it's your people's fault. And compared to the response, there were only a few comments, but still it hurt, because what else do you have to say for people to understand that this isn't an issue of culture or race, that this is a structural and institutional and political failure? This is not on the people of Peel. Just like Carlos Villegas shouldn't be feeling guilty, the people of Peel shouldn't be made to feel guilty for trying to live their lives as best they can in the conditions and with the cards that they've been dealt with. For Peel Region's cases to be attributed to brown people is completely ridiculous and frustrating, and based on some of the comments that I received, just heartbreaking. This is on the provincial government to address, because they have also perpetuated that narrative in some of the comments that they've made. And this is on them to own and on them to fix and on them to educate the rest of the province of the importance of Peel Region, of the way Peel Region has been neglected and abandoned, to own those mistakes, to fix them, and to really tell the rest of the province that these are the people that have allowed you to comfortably stay at home. And if anything, they need to be thanked. So when Dr. Dasani says, when we look back, we're going to wish we better served Peel Region, that's true. But more than that, we have to put Peel on a pedestal, because they did the hardest thing during this pandemic. They went to work. They left their house every single day, put themselves at risk, and went to work to put foods on their table and ours. And for that, they deserve to be put on a pedestal, to be apologized to, and frankly, for elected officials to be held accountable for every single death, every single COVID case that has happened in this region.
Fatima, thank you so much for sharing your reporting and having this very important conversation.
Thanks for having me, Sabah.
I was talking to Fatima Syed, a freelance journalist from Peel. She's also the host of an upcoming Canadaland podcast, The Backbench. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabah Itazaz, Adrian Chung, and Raju Murter. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.